Today we'll be looking at acute alcohol intoxication. And as usual, we'll start with a quiz. A client with acute alcohol intoxication is being treated for hypomagnesemia. During assessment of the client, the nurse would expect to find bradycardia, negative Shostak sign, hypertension, positive Trousseau sign. Okay, I know the correct answer would be D, which would be a positive Trousseau sign, because Trousseau sign refers to the involuntary contraction of the muscles in the hands and the wrist, which we also refer to as carpopedal spasm. And this occurs after compression of the upper arm with a blood pressure curve. So, okay, you're going to compress the upper arm and you're going to see carpopedal spasm, which are those involuntary contractions of the muscles in the hands and also in the wrist area. Okay, A is also incorrect because the client would have tachycardia and not bradycardia. B is also incorrect because the client would have a positive Shostak sign. What's a Shostak sign again? There's a clinical finding that's associated with hypocalcemia or low levels of calcium in the blood. You'll see this twitching of the face, which occurs when you gently tap an individual's cheek or in front of the ear. So you tap the cheek or the front of the ear, and you're going to see the twitching of the facial muscles. So that's your positive Shostak sign. And C is also incorrect because the client would have hypotension, not hypertension. Alcohol intoxication or acute alcohol intoxication is a condition associated with drinking too much alcohol in a short amount of time. It's also called alcohol poisoning. What are you going to see if you assess your patient? We're going to see drowsiness in the client. You're going to see slurred speech. We're also going to see tremors. There'll be impaired thinking. There'll be memory loss. There'll be nystagmus, which is that involuntary eye movement, which causes the eye to rapidly move from side to side, up and down, and in a circle, and may slightly blur the client's vision. We're also going to see diminished reflexes. There will be nausea and vomiting. There will be possible hypoglycemia. You will also notice increased respiration in these clients. There will also be belligerence and grandiosity. Remember, a belligerent person is hostile. The person is also aggressive, while grandiosity refers to that pompous superiority or pretentiousness of your client. So there will also be loss of inhibitions, and the client could also be depressed. Remember, your nursing diagnosis for this client would include acute confusion because of the drowsiness and all of that. There's also risks for injury. There's also risks for ineffective breathing pattern. And again, there's also risks for aspiration. So you could see some of the symptoms. You also see, like in the picture, the feeling of jumpiness or nervousness. There'll be anxiety, irritability, or easily excited. There'll be emotional volatility, rapid emotional changes, feeling of shakiness, fatigue, and also depression, like we mentioned. So part of your nursing considerations, you want to monitor the vital signs frequently, allow clients to sleep it off. You want to allow them to sleep off the excess alcohol in their system, protect the airway from aspiration. You also want to assess the need for IV glucose because of the possible hypoglycemia we referenced in our assessment. You also want to assess for for injury because of the drowsiness in your clients. Also counsel about alcohol use. There's also a potential problem of alcohol poisoning and CNS depression, so you want to look out for that. And we also want to assess for signs of withdrawal and chronic alcohol dependence. So with alcohol withdrawal, we could have withdrawal syndromes, we could have delirium tremens. So with alcohol withdrawal syndrome, this refers to the symptoms experienced when a heavy drinker drastically reduces or stops their alcohol intake. So that's what we refer to as alcohol withdrawal syndrome. While with delirium tremens, it usually has a rapid onset. So you see rapid onset of confusion, when there's this withdrawal from alcohol. And when it occurs, it is often 3 days into the withdrawal syndrome. So you see this 3 days after or into your withdrawal syndrome phase. And this could last 2 to 3 days. Okay, so you're going to see tremors with alcohol withdrawal syndrome. There's going to be tremors. The person will be easily startled. There will be insomnia, inability to sleep. There will be anxiety, loss of appetite, and there will also be alcoholic hallucination. With delirium tremens, there would also be tremors and anxiety. There will be panic. There will be confusion and disorientation. You would also see hallucination, nausea and vomiting. There would also be paranoia. So paranoia, again, is that unrealistic distrust of others, or the client will have a feeling of being persecuted. It could, in extreme degrees, this may be a sign of mental illness. So you're going to see paranoia in your client. We're also going to see delusional symptoms, ideas of reference, which are false beliefs that random or irrelevant occurrences in the world directly relates to that person. So those are your ideas of reference. If everything is about the person, that's false belief that random occurrences or irrelevant occurrences in the world directly relates to your clients. So you're going to see that in your clients. So here the person believes their thoughts, actions, or presence caused something to occur. So these irrational thoughts are considered ideas of reference. So you're going to see them in delirium tremens. There's also going to be suicide attempts. You could also see grand mal convulsions, especially the first 48 hours after drinking has stopped. So you want to note that grand mal convulsions, especially in the first 48 hours after drinking has stopped. There's also a potential for coma and death. As part of our nursing considerations, we're going to administer medications as needed, like your benzodiazepines. Remember, you can also use your benzodiazepines to treat conditions such as anxiety, insomnia, seizures. So examples of your benzodiazepine would be your alprazolam, which is your Xanax. There's also chlordiazepoxide, which is your Librium. You could also use clonazepam or clonipine, or lorazepate, which is your Traxine, or even your regular diazepam. So we can use this for sedation as needed for these clients. We also need to monitor vital signs, particularly the pulse, the blood pressure, and temperature. Look out for, assess or monitor for seizure and put in some precautions. Provide a quiet, well-lit environment. Orient your client frequently. You don't want to leave a hallucinating or confused client alone, so you want to stay with your patient. We would also need to administer anticonvulsants as needed. Again, most importantly, we'll need to administer thiamine, IV, or IM as needed. Remember, it's well known that chronic alcoholics are at a high risk for being deficient in vitamin B1, which is your thiamine. And this can actually put the client at an increased risk for Wernicke-Korsakoff syndrome. Again, deficiency in thiamine 4 could actually put your client at high risk for Wernicke-Korsakoff syndrome. They could also suffer cerebellar degeneration and cardiovascular dysfunctions. So again, we want to administer IV glucose as needed for that possible hypoglycemia we talked about. So for your clients with chronic alcohol dependence, your potential nursing diagnosis, the most priority for these clients is imbalanced nutrition, less than body requirements. They also suffer from chronic low self-esteem, social isolation, and dysfunctional family processes related to the alcoholism. As part of our assessment, you're going to see persistent incapacitation. They are usually unfit for normal functioning. We're also going to see cyclic drinking or binges. You see this excessive indulgence in an activity, especially the drinking part. So you're going to see binges or cyclic drinking. There's going to be daily drinking with increase in amounts. There's also a potential for chronic central nervous system disorder. We'll look at that in the next slide, for those potential CNS disorders as a result of the chronic alcohol dependence. Sexual relationships may be disturbed. And you also see others in the family trying to take over the alcoholic's role. For example, children may take parents' role, and that will result in loss of childhood opportunities. The children also often feel shame and embarrassment as a result of the chronic alcohol dependence of their parents. And a high percentage of children develop problems with alcohol themselves. So you also want to keep that at the back of your mind. And again, there's increase of family violence with alcohol use, with increased alcohol use. So let's look at the potential central nervous system disorders that are associated with alcoholism. We talked about that in the last slide. So one of them would be your alcoholic chronic brain syndrome or dementia. So the clients with these syndromes are going to be fatigued, they'll be anxious, you'll notice personality changes, they'll be depressed, they'll be confused, they usually have loss of memory of recent events, and this can actually progress to dependence and also progress to a bedridden state. With Nclex syndrome, you're also going to see confusion, diplopia, which is your double vision, nystagmus, which we said is that involuntary eye movement that causes the eye to move rapidly from side to side, up and down, or in a circle. There's also going to be ataxia. You're going to see ataxia in your clients. So remember, ataxia is that group of disorders that affect coordination. It affects balance. It affects speech. And any part of the body can be affected. But people with ataxia often have difficulties with balance and walking. They have difficulties with speaking. They also have difficulty with swallowing. So you're going to see this in your client. There's also going to be disorientation and apathy. With Korsakoff's psychosis, there's going to be memory disturbances with confabulation. So what's confabulation again? This is a symptom where the client starts to make up stories to fill in gaps in memory. So you're going to see confabulation in your client. There's also going to be loss of memory of recent events. The client will exhibit learning problems. There will also be possible problem with taste and smell, and also loss of reality testing. In terms of our nursing consideration, you could see there's a unifying factor there, the balanced diet. We want to also give thiamine because we said they could have deficiency in thiamine or your vitamin B1, which puts them at risk for this syndrome and also for cerebral degeneration and cardiovascular dysfunction. So we want to give thiamine, either IV or IM. And again, we want to encourage abstinence from alcohol. As part of our plan, we want to counsel the alcoholic. We want to identify problems related to drinking in family relationships, work, and other areas of life. You want to help the client to see the problem. He needs to admit the problem. You want to confront denial with slow persistence and maintain relationship with your clients. We also want to establish control of drinking problem. For example, we want to give concrete support to identify potentially troublesome settings that triggers this drinking behavior. We want to refer to Alcoholics Anonymous, where they can get valuable mutual support. So it's a support group for alcoholics. So you have peers share their experiences, peers who are alcoholics. They also learn to substitute the excess alcohol with contacts with fellow humans and colleagues. So that's part of what they will learn in the group. And again, you want to stress living in the present, and they need to stop drinking one day at a time. So you want to encourage one day, stop drinking one day at a time. We can also give Disophram, which is a drug that is used to maintain sobriety. It's actually based on behavioral therapy. So once sufficient blood level of this Disophram has been reached, it would interact with alcohol. If the client takes in any alcohol, provide severe reaction, causing many of the effects of a hangover to be felt immediately following alcohol consumption. So it's going to cause the client to be in a miserable state if he takes alcohol while on Disophram. So again, you want to be conscious of symptoms of Disophram alcohol reaction. So you would see flushing, there will be coughing, difficulty breathing, nausea and vomiting, pallor and anxiety. It's actually contraindicated in diabetes mellitus, atherosclerotic heart disease, cirrhosis of the liver, kidney disease, and psychosis. Again, you also want to counsel the spouse of the alcoholic. The initial goal is to help the spouse focus on his or herself. So you want to explore life problems from the spouse's own perspective, from her own point of view. And then once the spouse is able to be strong enough, then she can attempt to help her alcoholic partner. You can also refer them to Alcoholics Anonymous or Al-Anon, which is a self-help group of spouses and relatives of alcoholics. So they need to learn loving detachment from alcoholic. The goal is to try to make one's own life better and not to blame the alcoholic. The group would also help to provide safe and helpful environment. Again, we also need to counsel children of alcoholic parents, help them to overcome the denial of the problem. You want to establish trusting relationship. You also want to work with the parents as well, avoid negative reactions to parents, and can refer them to Al-Ateen, which is another organization for teenagers of alcoholic parents. It's a self-help group that is similar to Alcohol Anon or Al-Anon. We're going to end with a quiz. A client is taking the drug Disophram. A client taking the drug Disophram is admitted to the ER. Which clinical manifestations are most indicative of recent alcohol ingestion? Vomiting, heart rate 120, chest pain. Nausea, mild headache, bradycardia. Respiration 16, heart rate 62, diarrhea. Temperature 101, tachycardia, respirations 20.